Good morning to everyone. Today we are discussing about bones. First of all, in bones we are going to discuss about clavicle. What is meant by clavicle? Clavicle is a long bone and it supports the shoulder so that arms can swing. And these clavicle transmit the weight of limb to the sternum. And the clavicle has a shaft and two ends. The ends are lateral end and the medial end. Now, side determination. How we should determine the clavicle? Side determination has some of the characters like the shaft is curved, so that is convex forwards in its medial two-thirds and concave forwards in its lateral one-third. The lateral end is flat and the medial end is large. This is very important for the side determination of clavicle. And the inferior surface is grooved longitudinally in its medial one-third, and this groove is known as subclavian groove, and there is also a nutrient foramen on the medial side. Now, the peculiarities of the clavicle. What are the peculiarities of the clavicle? As we know, it is the only long bone that lies horizontally and it is subcutaneous throughout, means it is present below the skin, and it is the first bones to start ossifying, and it has two primary centers of ossification, and it is the only bone which ossifies in the membrane, and there is no medullary cavity. These are the peculiarities of the clavicle, and this clavicle receives weight of the upper limb via the lateral one-third and transmit the weight of upper limb to the axial skeleton via medial two-third parts. Now, features. What are the features of shaft? The shaft is divided into lateral one-third and medial two-thirds. The lateral one-third is flattened and it has two borders and surfaces. The borders are anterior border and the posterior border. The anterior border is concave forwards and the posterior border is convex backwards. Now these two surfaces, superior surface and inferior surface. The superior surface is subcutaneous as we know, and the inferior surface present an elevation called the conoid tubercle and a ridge called the trapezoid ridge. These conoid tubercle and trapezoid ridge are present on the inferior surface of the shaft. And the medial two-thirds of the shaft is rounded and is said to have four surfaces. Lateral one-third have two borders and two surfaces, and medial two-third of the shaft has four surfaces. The anterior surface is convex forwards and the posterior surface is smooth, and the superior surface is rough in its medial part, and the inferior surface has rough oval impression at the middle end. And the lateral half of the surface has longitudinal subclavian groove where the nutrient foramen lies at the lateral end of the groove. Now, lateral end and the medial end. The lateral end or acromial end is flattened above downwards. It bears a facet that articulates with the acromion process. So, it is also called acromial end because it articulates with acromion process of the scapula to form acromioclavicular joint. This lateral end of the clavicle articulates with the acromion process of the scapula and forms acromioclavicular joint. The medial or sternal end is quadrangular and articulates with the clavicular notch of the manubrium sterni to form sternoclavicular joint. This medial one-third of the shaft articulates with the manubrium sterni and it forms sternoclavicular joint. And now, as we completed the side determination, peculiarities, features like shaft and lateral and medial end as shown in the figure. Now, attachments. First of all, we should know the attachments of the clavicle, like there are two joints like acromion clavicular joint and sternoclavicular joint. The lateral one-third end, the margin of the articular surface for its acromial joint, gives attachment to the joint capsule. At the medial end, The margin of articular surface for sternum gives attachment to fibrous capsule for sternoclavicular joint and articular disc posterior superiorly and interclavicular ligament superiorly. These attachments are clear in the figures. Now the lateral 1/3 of the shaft. The anterior border gives origin to deltoid muscle. We know lateral 1/3 of the shaft has two borders and two surfaces. In that, anterior border gives origin to deltoid muscle, and the posterior border provides insertion to trapezius muscle, and the conoid tubercle and trapezoid ridge, which are present on inferior surface. This conoid tubercle and trapezoid ridge, which are present on inferior surface, gives attachment to the conoid and trapezoid parts of corococlavicular ligament. Now, medial 2/3 of the shaft. Medial 2/3 of the shaft has four surfaces, and the most of the anterior surface gives origin to the pectoralis major. Half of the rough superior surface gives origin to clavicular head of sternocleidomastoid muscle. Now, the oval impression on the inferior surface at the medial end gives attachment to the costoclavicular ligament, and the subclavian groove, which is present on medial, gives insertion to subclavius muscle, and these margins of the groove which give attachment to the clavipectoral fascia. The posterior surface close to medial end and gives origin to sternohyoid muscle, and the nutrient foramen transmits a branch of suprascapular artery. This is about the attachments. Mainly we have attachments like deltoid, trapezoid on lateral 1/3, and corococlavicular ligament is also on lateral 1/3, and medial 2/3 we have pectoralis major, clavicular head of sternocleidomastoid muscle, and costoclavicular ligament, subclavius muscle, clavipectoral fascia, and sternohyoid muscle. Now we should discuss about the ossification. As we know, it is the only bone that ossifies in the membrane, and it has two primary centers and one secondary center for ossification. These two primary centers of ossification appears in the shaft between the 5th and 6th week of intrauterine life, means inside the mother womb. At the month of 5th and 6th, at the week of 5th and 6th week, these two primary centers appears and fuses about the 45th day of intrauterine life, and these secondary center for the medial end appears during 15 and 17 years, which is called puberty, and fuses with the shaft during 21 to 22 years. Occasionally there may be a secondary center for the acromial end also. So we have two primary centers and one secondary center for the ossification. Thank you. Please subscribe the channel.